Hi folks, Nurse Ninja here. Basically, talking about gastroesophageal reflux disease (GER). Before it turns into GERD, it is GER. This is regarding infants, since I am taking the peds class. Basically, it is when the gastric contents refluxes and goes back up the esophagus. The assessments would be: you want to check the laboratory test, pH acid test of the intraesophageal area. 24 hours, you got to monitor that. You would actually see aggressive vomiting and spitting up, blood in the stool or the vomit. You'll see apnea and an apparent life-threatening event. Uh, Diagnostic procedures would be pH monitoring of the intraesophageal area, endoscopy with biopsy, and scintigraphy. The type of people who are most at risk are premature babies with congenital defects, like neural defects, esophageal defects, hiatal hernia, cystic fibrosis, or cerebral palsy. Um, Collaborative care would include giving omeprazole, ranitidine, H2 receptor antagonists. You gotta lay them prone to sleep, so that's the only time you're gonna have a baby sleeping facing down, so that they won't like choke or aspirate on any refluxed gastric contents. You have small, frequent feedings of thickened formula, and you want to have them lay down with 30 degrees increase of their head of bed after eating. So basically, after they eat, after you feed them, you want to put their head of the bed 30 degrees up. Surgical intervention would be the Nissen fundoplication. Basically, they take part of the stomach, this is the fundus of the stomach, and they wrap it around the distal part of the esophagus so as to prevent the contents from coming back up, because it usually comes up because of the sphincter of the top part of the esophagus is not working correctly. So that's surgical treatment. Client outcomes: you want them to be free of infection, remain hydrated, maintain adequate nutrition, and then after discharge, you want to position the infant head of bed slightly elevated for like about 3 days. Encourage the parents to be active in the child care, and then teach the parents signs and symptoms of dehydration, how to assess the incision site for signs and symptoms of infection, and demonstrate hand hygiene. And basically, nursing care and family care is what's going to take care of the baby. And that's all for now, so take care of yourself. Thanks.